It's Chapter 33, Obstetrics and Neonatal Care. Most deliveries are going to occur in a hospital with doctors and nurses in attendance. However, occasionally the birth process moves faster than a pregnant woman expects, or she's unable to get to the hospital. And so you as the EMT must decide whether we're going to assist the delivery on scene or transport the patient to the hospital. So we've already talked about anatomy and physiology of the female reproductive organ. We're going to go through that again here really quick. So the ovaries are two glands, one on each side of the uterus. Each ovary contains thousands of follicles. Each follicle contains an egg. Ovulation occurs about 2 weeks prior to menstruation, and that's what allows for conception. Fallopian tubes extend out laterally from the uterus. There's one on each side. Fertilization usually occurs when a sperm meets an egg inside the fallopian tube, and then that fertilized egg continues to the uterus where it implants and then becomes an embryo. The uterus is a muscular organ that encloses and protects the developing fetus. It produces contractions during labor, helps push the fetus through the birth canal. The birth canal itself is made up of the vagina and the lower third of the uterus called the cervix. That's what actually opens up into the uterus itself. Here's the overall look of what we're seeing with a pregnant uterus. The fundus is that top curved portion. The placenta you can see inside, and then the uterus obviously is quite stretched compared to what it normally is. The vagina is the outermost cavity of the reproductive system. It forms the lower portion of the birth canal. It completes the passageway from the uterus to the outside world, and there is nothing that keeps the outside world from getting up into the uterus except for the cervix itself. The breast-produced milk is carried through small ducts to the nipple to provide nourishment to the newborn once the baby is actually born. The placenta is a very important organ. It's a disc-shaped structure that's attached to the uterine wall that provides nourishment to the developing fetus. It's connected to the fetus by the umbilical cord. The placenta barrier consists of 2 layers of cells which keep the circulation of the woman and the fetus separate, but allow substances to pass between them. Anything ingested by a pregnant woman has the potential to affect the fetus, including nutrients, oxygen, waste, carbon dioxide, many toxins, and most medications. After delivery, the placenta separates from the uterus and is delivered. The umbilical cord is the lifeline of the fetus, connecting the woman and fetus through the placenta. The umbilical vein carries oxygenated blood from the placenta to the heart of the fetus. The umbilical arteries carry deoxygenated blood from the heart of the fetus to the placenta. The fetus develops inside a fluid-filled bag-like membrane called the amniotic sac. It contains about 500 to 1,000 milliliters of amniotic fluid, which helps insulate and protect the floating fetus. The amniotic fluid is released in a gush when the sac ruptures, usually at the beginning of labor. Some women don't even know they're in labor until their water breaks. Normal changes in pregnancy. During pregnancy, many normal changes occur in the body that are not all related to the reproductive system. The primary systems involved with these changes are respiratory, cardiovascular, and the musculoskeletal systems. In the reproductive system, hormone levels increase to support fetal development and prepare the body for childbirth. This puts pregnant women at an increased risk for complications from trauma, bleeding, and some medical conditions. As the fetus develops and grows, the uterus also grows, stretching to accommodate a full-term fetus. As the size of the uterus increases, so does the amount of fluid it contains. The uterus is displaced out of its normally well-protected position within the pelvic area, and the increase in size increases the chance of direct fetal injury from trauma. Rapid uterine growth occurs during the second trimester of pregnancy. As the uterus grows, it pushes up on the diaphragm, displacing it from normal position, which leads to respiratory capacity changes with increased respiratory rates and decreased minute volumes. So the amount that you can take in one breath or over a minute decreases significantly. Overall blood volume gradually increases throughout the pregnancy to allow for adequate perfusion of the uterus and to prepare for the blood loss that will occur during childbirth. The blood volume may eventually increase as much as 50% by the end of the pregnancy. The number of red blood cells also increases. The speed of clotting increases to protect against excessive bleeding during the pregnancy and delivery. By the end of the pregnancy, the woman's heart rate increases up to 20% to accommodate the increased blood volume. However, this has more of a effect on cardiac output because that is significantly increased as well. In the third trimester, there is an increased risk of vomiting and potential aspiration following trauma because of changes that occur in the gastrointestinal tract. Changes in the gastrointestinal motility and displacement of the stomach upward significantly increase the chance that a pregnant trauma patient will vomit and aspirate if you're unable to clear her airway. Changes in the cardiovascular system and increased demands of supporting the fetus significantly increase the workload of the heart. Remember, not all women are healthy when they begin their pregnancy, and cardiac compromise is a life-threatening possibility for somebody that is struggling to maintain adequate perfusion. Weight gain during pregnancy is normal. The increase in body weight will eventually challenge the heart and impact the musculoskeletal system. Increased hormones affect the musculoskeletal system by making joints looser or less stable because you have to accommodate the growing uterus, the way the body needs to shift its center of gravity, and then to prepare for delivery. In the third trimester, changes in the body's center of gravity increase the risk of slips and falls. Complications of pregnancy. Most pregnant women are healthy, but some may be ill when they conceive or become ill during the pregnancy. You may safely use oxygen to treat any heart or lung disease in a pregnant patient without harm to the fetus. Other medications tend to pose a risk or could potentially pose a risk to the developing fetus. Diabetes that develops during pregnancy is called gestational diabetes, The condition resolves for most women after delivery, and this can be women that have not had any sort of diabetic problems prior to the pregnancy. The treatment is the same as for other patients with diabetes. A pregnant woman may control her blood glucose level with diet and exercise or may take medication. In some cases, the woman will have to manage her condition with insulin injections. A pregnant woman experiencing hyperglycemia or hypoglycemia should be cared for in the same manner as any other patient with diabetes. Hypertensive disorders. One complication that occasionally occurs, typically in patients who are pregnant for the first time, is preeclampsia or pregnancy-induced hypertension. This condition can develop after the 20th week of gestation, so about halfway through the pregnancy, and is characterized by the following signs and symptoms: severe hypertension, severe or persistent headache, visual abnormalities such as seeing spots, blurred vision, or sensitivity to light, swelling in the hands or feet, which is also called edema, and then anxiety as well. A related condition, eclampsia, is characterized by seizures that occur as a result of hypertension. To treat a patient having seizures caused by eclampsia, lay the patient on her left side, maintain her airway, administer supplemental oxygen if needed. If vomiting occurs, make sure that you adequately and aggressively suction the airway. Provide rapid transport and call for an ALS intercept if available. There is some medication that we can give to help stop the seizure. Transporting the patient on the left side can also prevent supine hypotensive syndrome. This condition is caused by the compression of the descending aorta and inferior vena cava by the pregnant uterus. If the patient lies on her back or supine, hypotension may result. It tends to make them really, really dizzy and So make sure that you prop them up on that left side anytime that you're transporting a pregnant woman. And typically she's going to tell you she doesn't feel good. So she's going to want to prop up on that side if at all possible. Bleeding, internal bleeding may be a sign of an ectopic pregnancy or when an embryo develops outside of the uterus, most often going to be in that fallopian tube itself. It occurs once in every about 300 pregnancies. It's the leading cause of maternal death in the first trimester because of that internal hemorrhage into the abdomen following the rupture of that ectopic pregnancy. Consider the possibility of an ectopic pregnancy in a woman who has missed a menstrual cycle, complains of sudden, severe, usually unilateral pain in the lower abdomen. Hemorrhage from the vagina that occurs before labor begins may be very serious. Call for ALS backup. In an early pregnancy, it may be a sign of spontaneous abortion or miscarriage. In later stages of pregnancy, vaginal hemorrhage may indicate a serious condition involving the placenta. In abruptio placenta, the placenta fully separates or partially separates prematurely from the wall of the uterus, most commonly caused by hypertension or trauma. The patient often reports severe pain, but vaginal bleeding may not be heavy. In placenta previa, the placenta develops over and covers the cervix, so the patient may experience heavy vaginal bleeding without significant pain. And here's pictures of both of them. So in the left-hand picture, you can see the hemorrhage is kind of contained. That's why you're not going to see a lot of bleeding. The placenta itself is detached. There's lots of bleeding in there, but the bleeding's possibly not going to come out of the vagina at all, so you may not see it. In placenta previa, you can see that that placenta has actually covered that cervical opening, so baby can't get out, but repeated pressure on that area from baby trying to come out can cause significant bleeding, but there's typically no pain or very, very little pain. An abortion is any passage of the fetus and placenta before 20 weeks. Not typically what you would call, yes, there's an elective abortion that people choose to terminate the pregnancy, but abortion is any termination of the pregnancy, either natural or elective, before 20 weeks. So we typically tend to call them miscarriages rather than abortions. They may be spontaneous or induced. Deliberate abortions may be self-induced or planned and performed in a hospital or clinic. The most serious complications are bleeding and infection. Bleeding can result from portions of the fetus or placenta that are left in the uterus, which is considered an incomplete abortion, or from injury to the wall of the uterus. Infection can result from such perforation, so going through the uterus, and then from the use of non-sterile instruments. If a woman is in shock, treat and transport her promptly to the hospital. Never try to pull tissue out of the vagina. Just place a sterile pad, no packing, just trying to catch some of that blood that's coming out. Abuse. Pregnant women have an increased chance of being victims of domestic violence and abuse. Abuse during pregnancy increases the chance of spontaneous abortion, premature delivery, and low birth rate. The woman is at risk from bleeding, infection, and uterine rupture. Use a calm and professional approach. Pay attention to the environment for any signs of abuse. Your attention to detail will be helpful in your documentation. Pregnant patients who are abused are often scared and may not be honest as to how their injuries have occurred. Talk to the patient in a private area away from the potential abuser, but do not attempt to confront the abuser. The best way for you to care for the fetus is to care for the pregnant woman. We'll go ahead and stop here.